Hi, everyone. My name is Sydney Hudgens. Today I will be talking about community health in Matthews County, Virginia. Just a quick agenda. First, we're going to go over the geography of Matthews County. Then I'll be telling you a little bit about our community. Then I'll be covering my healthypeople.gov objective and then giving you guys some data and then a summary. So as far as geography, we are composed of several counties within one area. So for example, when you're addressing your mail, you can't put Matthews County as the city. You have to use the part of the county that you live in. I actually live in Cobbs Creek, and most of us use PO boxes. A lot of us don't actually receive mail to our homes. So I could have a PO box in Cobbs Creek, and somebody else could have the same PO box in Moon or Diggs or New Point. They all have their own post offices. So Matthews consists of Cobbs Creek, Onemo, Foster, Moon, Diggs, Susan, New Point, and Cardinal. And then, of course, within that, we have smaller places, such as like Bohannon. We have Mob Jack, and a couple other places within those counties. Just a little bit about our community. We're a very small, tight-knit community. We actually don't have any neighborhoods other than on Main Street. There's actually no sidewalks. We have one grocery store, which is a Food Lion. We don't have a single stoplight in our county. We have a large amount of vacation homes. A lot of people from Richmond and Northern Virginia like to vacation here. We have no public water or sewer systems. I believe Main Street does, but the rest of the county is on well and septic. We only have one elementary school, one middle school, and one high school for the whole county. We are surrounded by water. We have the Chesapeake Bay, the Rappahannock River, the North River, and Mob Jack. And we actually have no form of public transportation. As far as my healthy people objective, I chose to increase the proportion of people with a usual primary care provider. A large problem in our community is lack of primary care providers and the ability for our older adults to travel to appointments. According to the National Association of Community Health Centers, over 100 million Americans face barriers to accessing primary care. In Matthews County, we only have one primary care office. Any other options for primary care are at least a 20-minute drive in our neighboring counties of Deltaville or Gloucester. According to Healthy People 2030, in 2017, only about 76% of people had a usual primary care provider. The goal is 87%. This is only baseline information. There was no further information on improvement or decline, and this was a nationwide statistic. So like I said earlier, over 100 million Americans, which is about 1/3 of the nation, don't have access to primary care. This is mostly due to a shortage of providers in local communities, like we have here in Matthews. A lot of the times it includes people of all income levels, locations, age, race, ethnicities, and insurance status. Only 1 in 10 of the medically disenfranchised population are uninsured. We have a lot of issues with people here in Matthews County living in poverty and not having access to regular health care and insurance and not being able to afford their care. About 31 states have over 1 million medically disenfranchised individuals, and without health centers, 15 million more patients will be at risk of not having primary care. However, the number of health center patients has grown by 6 million since 2015, and that's a 24% increase. In Matthews County, according to the Community Indicators Dashboard of Greater Hampton Roads, there are only 34 primary care providers for a population of 100,000 as of 2020. I'm sure our population has grown since then, but probably not by much. According to the Agency for Healthcare Research and Quality, in 2010, there were 294,834 primary care providers, which consists of physicians, nurse practitioners, and PAs, for a population of 304,785,538 people in the United States. As far as increasing accessibility, I would like to see more primary care physicians come into our county. I'd like to meet with local healthcare systems to suggest opening primary care offices within Matthews County. We could definitely prove to them that there's a need for it, and then suggest physicians the idea of a mobile clinic, because a big issue that we have is a lot of our older adults aren't able to get to and from doctor's appointments. And we are on a volunteer rescue squad here. We have a part-time paid staff. We have 2 trucks during the day, and then after 9 p.m., we only have 1 rescue squad running. So if they're on a call and you call 911, you have to wait for either 2 volunteers to basically get out of bed and come get you, or you have to wait for a neighboring county to send mutual aid, which is going to take at least 15 to 20 minutes, if not longer, because a lot of our neighboring counties are also on a volunteer basis. So a lot of our older adults are having to use 911 more frequently because they aren't getting regular primary care, which is mostly due to lack of transportation. Like I mentioned earlier, we don't have access to public transportation. We do have a Bay Aging bus, but you have to meet certain criteria to get rides. A lot of our population is older adults that are unable to drive or unable to safely drive the distance necessary to reach their primary care provider, especially if they aren't able to get into an office in Matthews. They would have at least a 20-minute drive into either Deltaville or Gloucester. I've actually suggested to several churches that retired congregation members help with transportation to and from doctor's appointments. We have a lot of people that take turns driving a van to and from the shipyard, so that people aren't having to commute back and forth. And I think that would be a really good idea to kind of integrate into the community, because that would give easily accessible transportation, and the patients would be familiar with who's driving them, because I've honestly never met anyone in Matthews County that doesn't go to church every Sunday. And they could just use the church vans, and it would be a good way to get the retired folks out of their house and help our older adults get to their appointments. As far as gaps in service, like I mentioned before, there's only two primary care providers. One office has two providers, and the other has two providers with one nurse practitioner and a physician's assistant. And the one office is only open 2 days a week, so it's kind of hard to count them. Without the availability of primary care providers, it's difficult for our community to keep up with seeing a primary care physician. And then, as I mentioned before, we don't have public transportation, and most of our community is older adults unable to drive. Um, Being unable to get to appointments makes it difficult to regularly see a primary care physician. As far as the role of the nurse, we can incorporate education at discharge, whether it's from an inpatient stay or visit to the emergency department. A referral or suggestion for a primary care provider should be offered. The emergency room that I work in, anytime we discharge someone, if they don't have a regular primary care provider, we suggest one for them and put it on their discharge paperwork with an address and a phone number, and when we'd like for them to follow up. Um, a lot of patients are discharged from the hospital with no plans for follow-up care. There's a little bit less of that with inpatient stays, but as far as in the emergency room, some emergency rooms just discharge you and they don't really care what happens after you're discharged. And it's important to educate patients and their families on how important it is to have primary care, because a lot of times the issues that people come to the hospital for could have either been seen in a primary care office or could have been prevented by regular primary care. And then another role of the nurse is volunteering. Around Matthews County, we have two free clinics that provide primary, specialty, and dental services. These facilities are all volunteer based. There's physicians, nurse practitioners, PAs, nurses, medical assistants, dentists, ophthalmologists, and they all volunteer their time. A lot of these clinics aren't advertised very well. I believe if they were advertised better, more nurses could volunteer, and then they wouldn't have to be closed several days a week because they're only able to be open on days that they're staffed. And it's very important to educate patients of these free clinics, because a lot of patients, especially ones that I see in the emergency department, have no idea that these places exist. So that would be a great tool for our local community. And then I have my references.